and such an honor to be here tonight. Just to let you know, it's 10 p.m. California time, and I'd like to share with you some story. And hopefully, when I finish this presentation, we have a lot of discussions. All right, let me go ahead and see if can you see all my screen right now?
Yes.
Okay, good. All right, let me start with this. I do not have any interest, personal conflict or interest in this, because some of my slide you will see, or you may see, this is a little bit political indication, but this is how we are. We live in the US. So I do not have any personal, political, or financial conflict in the presentations. I also do not endorse any products, any parties, or person in these presentations. All right, I'd like to share with you the objective for today. Just to share with you an overview of COVID-19 situation in the US. I'd like to identify 5 major challenges in US situation, because I'd like to see why other countries like Vietnam and Japan and many countries did so well, and why our country, the US, did not do so well. So the 5 major challenges I'd like to share with you today are large population with high risk, public confidence in the government and people, poor coordination among and between state and federal agencies, and also the complexity of the US health system with many uninsured people, and then COVID-19 vaccine perception and distribution. As we are talking today, Thanksgiving holiday just passed by yesterday. Unfortunately, 13 million cases in the US and 265 families have to say goodbye to their loved ones. I told people that every single case is a love story to share. So to me, COVID-19 just pure a number. It is many things behind. COVID-19 also puts our country, the US, in the top 10 in terms of COVID-related death. The US contributes 25% of total COVID-19 cases globally, even though we contribute only 5% to the global populations. And obviously, you can see COVID-19 plays such an important role in US elections and impacts severely our economy. This graph just summarizes how COVID-19 arrived back in April and March, and now where we are in November 20 and 20s. You will see a continuous increase of number of cases, and also the positivity rate has fluctuated up and down. And we spoke today, we have a record number, and I don't need to tell you again, we are the #1 country in terms of number of cases. So everyone knows this. Why this happened? What do you think? I'd like you to think for a moment, and then we'll go back at the end to discuss why. Before COVID-19 happened, there is Global Health Index measure country in response to a pandemic. Then this is based on 6 categories: prevention of the emergence, release, or spread of the pathogens, early detection, rapid response, sufficient and robust health system, commitment to improve national capacity, and then rich environments and country vulnerability to biological threats. This, you may see this several times last year. And this is how the US was stand before COVID-19. Our country was evaluated by GSS, and we determined we are one of the best because we have a robust resources in epidemiology. We have high quality labs. We have well-trained epidemiologists, and we have a lot of things. However, the GSS did not evaluate all the factors. For example, COVID-19 population vulnerability. It did not evaluate the coordination and collaboration among and between state and federal agencies, and many, many others. In this picture, you can see the higher score, the better presume and assume that a country may respond to a pandemic. And obviously, US was one of the top countries. And when I look at this figure today, I cannot stop thinking, why? So let's go to the challenges, because to me, this may have an impact why the US did not respond well to the COVID-19. The first and one of the major challenges that I personally see in my clinic, in the hospital, and in every day when I treat COVID-19 patients is we do have such a high-risk population for COVID-19 in terms of mortality as well as morbidities. And what are these? Obesity, cardiovascular disease, aging population, chronic lung disease, and cancer. But let me emphasize one key thing that we try to fight over the year, because we are a country, unfortunately, we are a country of overweight. 2 in every 3 American is overweight, and 42% are obese, like almost 1 in 2, and 46% have high blood pressure, 1 in 2. Multiple study, meta-analysis from multiple studies show that a higher BMI is a predictor for COVID-19 poor outcome. In addition, cardiovascular and diabetes are predictor of poor outcome. And younger patients with higher BMI are also at risk. It's not just the general risk that we see or we know. This is our country population obesity in 2008. And if you look carefully, this map somehow can represent a number of COVID-19 mortality and morbidity related. And we are one of the unhealthy country. So there is a ranking from the United Kingdom. They derive data from WHO, the CIA Workbook, and then the World Lung Associations. And we are a top unhealthy country in the world. When I'm telling my student, my medical student, my fellow, my residents, I'm telling them, we are not a healthy country, and very few of them, believe it or not, realize that America is not a healthy country. So this to tell you the truth and the fact that we have a lot have to do, a lot we have to learn from other countries. Let's move on to major challenge number 2. And this is, it may touch into some political system or personal opinion, but I just give you the fact. In the US, we have such a low public confidence in government regarding many key measurements: physical distance, hygiene, mask requirement, follow-up and report lab results, and also self-isolation when contracted with COVID-19. How do we know? So let's look at some number. The Pew Research Center, one of the major research centers in the US, they did thousands of surveys, and surprisingly, those numbers that show up to tell you what is the general public perceptions. For example, when they ask about distrust, making problem solving harder, look at the number percent of people, they have problem with trust. And you will see a lot of them, the majority of them have problem with this. Let's go into details. The public have such a low confidence in the government into managing other things such as effectively handling threat to public health. You will see on the very bottom right here, versus keeping the country safe from terrorists. So in other words, most Americans believe the government, including the state and federal agency, did a good job in protecting them from terrorists, but not protecting them from public health issues. If you look at this number, you will see even such a low percentage public trust for a decade. If you follow back in 1958 into 2020s, you will see how the public trust. Okay, that's not bad enough. Let's move to the major. This is one of the major one is the US government structure with, believe it or not, is one of the major challenging when it comes to dealing with COVID-19. There are 2,000, let me tell you, 2,000 agencies responsible for COVID-19 respond in the US. And this is divided between and among state, federal agencies. This is such a complex task. And you will see that the CDC, the Department of Health, they have, believe it or not, very limited authority to direct local officers to take actions. For example, if CDC today required people in California have to mask mandating, they do not have that authority because the state have certain privilege and right to refuse or not to cooperate with the federal agency. The other issue is federal government had also uneven assistance to state, funding and supply delay. For example, the federal government have reference to some state versus other states. And let me tell you why. Because this is Republican versus Democrat state. The federal government at the moment is Republicans, and certainly they have some preference to Republican state. And other like Democrat state will have uneven assistance, and people have seen this for the past several months. Unfortunately, COVID-19 does not discriminate whether you are a Republican or a Democrat. It will attack everyone. So that's the message I'd like to share with you today is when people involved with political belief, it may damage or it may impact to how we respond to a pandemic. Another example here is in poor coordination. The US is not centralizing, it's such a decentralizing health system and into federal and local agency. Because of this, it's more cost. There's a lot of and low volume testing, and you will see that even such a robust epidemiology system, the US testing was not adequate until even today. For the past 10 months, we keep telling we need to test more people. Look at the lesson I learned today from Japan and Vietnam. See how aggressive those countries in terms of testing. We did not. Let's move on to the next challenge. And let me ask you what it is. This is a complex healthcare system in the US. This picture, just to tell you, is it how Obamacare is. Why I show you this picture? Because imagine if you are a patient, can you navigate through this system? There's almost no way because so much complexity. And to be honest with you, as a doctor, I even cannot figure out. It took me so many months or a year to learn about this. And the moment you learn about this system, they change to a different system. Now they talk about not doing Obamacare, it's something else. There are 4 or 5 stakeholders in the US healthcare system. And the most important person in this one is patient. We all know this. But if you look at this model again, a patient is not in the center because it's been involved with many, many things. It's not the patient in the center here. It's such a complex healthcare system. And yet, the healthcare expenditure in the US is higher than those developed countries. We actually one of the highest. And look at the number here. We spend over $11,000 per capita. And some other country like Italy or United Kingdom, we spend a double. And then look at the number of administrative costs. We are one of the most expensive country. Yet we do poorly in terms of outcome. Look at how we compare to other countries. We're not certainly the best, you can tell. And some of us actually do really, really bad in terms of, for example, infant mortality. We're doing so poor. And then other countries, you can tell right here, the quality of primary care in the US, just mediocre. It's not one of the best. Let me move on to the final one. And because this is one of the key challenges, the vaccine. You may heard in the past 4 weeks some good news about new vaccine for COVID-19, but the vaccine implantation is a key challenge in the next couple of months. Why? Because look at this picture. We have a lot of issue already. We have trust issue. We have federal, state, and local issue. And now we think about supply and logistic, and then coverage and cost. So let's dig into that. As we spoke today, November 2020, we have 13 vaccines in phase 3, and 6 of them already be in limited use. So the 2 most promising one is from Pfizer and Moderna. And each costs about $40 to $50. And those 2 vaccines are expected to deliver a lot, many doses to the US and also globally. Well, one of the key things when you look at it in terms of logistics is Pfizer requires such a super cold, like minus 70 Celsius degrees versus Moderna minus 20s. So those could be challenge to many hospitals. But to me, that's not the real challenge. So as we spoke today, Pfizer, they already applied for EUA, the emergency use authorizations, and the FDA is scheduled to have a meeting on December 10th, whether to approve this or not. So hopefully in a couple of days, we will hear. But the most challenging aspect for COVID-19 vaccine is not about logistics. It's about the American people. It's about, should you take the vaccine? So let me walk you back in September. Then what happened? In September, depends on who you are, whether you're Democrat or you're Republicans, then you have different perception on vaccine. And this is just unbelievable. I will tell you, it is just unbelievable because, again, COVID-19 will impact you no matter what. It doesn't matter whether you are Republican or Democrat. This is a disease, and this is a highly contagious disease. So look at the people right here. Some of them will get the vaccine, some of them will not. Moving forward to November, which is this month, now more Americans are willing to take vaccine with a recent study. And I hope that will be the trend in the next couple of months. The final little bit challenge, not major one, is how do we prioritize a vaccine? So based on this, we have a lot of people need to vaccine as soon as possible. We call tier 1, 26 million people. Those are really high risk population. And these are frontline workers, doctors, nurses, and pharmacists. In summary, there are many challenges to have an optimal response for COVID-19 in the US. So those are a large population with high risk. We have a lot of people with overweight and obesity, cardiovascular disease, and many other chronic problems. We have low public confidence in the government and also within people, and poor coordination among and between states and federals, complexity of a healthcare system with many uninsured people. And then last one is COVID-19 perception and distribution. would be another challenge. Thank you very much for VNG to invited me for this wonderful conference. And here's my email and time for questions. Thank you.
Thank you very much, Dr. Wynn, for your brilliant talk about the effect of COVID-19 in the USA. And you also supply many potential causes and the complexity of the society and healthcare system in the US. Really, I'm really impressed by your talks. Thank you very much.
Thank you, Dr. Wei.
Dr. Ang, may we receive some comments or question from the floor?
Yeah, I received one question that as Americans got problems of NCD, the financial burden is quite high. If they got COVID, who will pay for them? No.
Thank you for this excellent question. This is a practical questions. Let me tell you very brief. The patient will not pay for this. If the patient have commercial or state insurance, they will be covered by this. And even if they do not, almost any state, for example, California, we do have a program for people who have uninsured and no resources. So ultimately, there is some payment assistance to COVID-19 patients. It will take time. It won't happen automatically, but the patient usually they apply for assistance and they should receive from that. But also, this is a time for me to send a message to many people. If you have COVID-19 or if you are afraid of COVID-19 and you need medical care, please do not delay your care, because many patients have cardiovascular disease, cancer, because they're afraid of COVID-19. They did not go to the hospital. Unfortunately, I have one particular patient have a heart attack at home, and he did not make it. The patient were afraid of COVID-19 if he's going to the hospital. And similarly, I have other patients have no insurance, and they also are afraid. So the message is take care of yourself first, and it's okay to seek care.
Thank you very much. I can see Dr. Wynn from the beginning of the pandemic really update every day about COVID-19 and related disease, and try to teach people how to cope with comorbidity that can reduce the risk of the disease. Thank you very much for your effort. And for the last question, I would like to ask your personal opinion about vaccination. In the case of Vietnam, you know, we already know that we don't have such a high risk feature for COVID-19, and we are doing really well during this pandemic. Do you think that we really need the vaccination?
In my opinion, I think every country have a different situations. So I do not think one country should apply to or use other countries. Like this conference, we learn from that. But I do believe the prevention is a multifactorial. I really like Dr. New mentioned on early detections and early containments. And then I think vaccine is one, I say just one of many features, many key we need to work together. I told people again, vaccine alone will not solve the problem. It will not. You need a total package. You need to address many other issues. I told my resident all the time, if you can help me control diabetes, control high blood pressure, control overweight in the next 10 years, then if COVID-30 happened or whatever COVID-29 is, you save a lot of people already. It's not just vaccine. It's not just one factor, just like we talked today. Many, many factors. Thank you, Dr. Wee.
Right. I totally agree with you. Thank you very much. And I just read a newspaper today mentioned about the negative effect of COVID-19 all over the world. And I know that all of us think about COVID as a very bad one, but actually there's very good information related to innovation that really happened during the COVID-19 pandemic.